And we're back. This is Center for Community Growth Webcast, used to be radio, and we're coming to you April 5th, 2020. We're bringing, this is our 5th episode, bringing our local community, Indiana County and Indiana surrounding areas, updates about the COVID-19 epidemic. Please check out our Facebook pages, YouTube pages. We have clips of all of our episodes, trying to do the best we can to get information out there. Next up, our next guest is Dr. David Loomis. He's back from last week. He's been writing articles talking about the quality and the quantity of the information getting out here to people. And he has a recent article titled Coronavirus Diary, talking about the creep of the epidemic into rural areas and detailing the local response. Welcome for joining us, Dr. Loomis.
Good to be back.
Could you tell us, give us a summary of what you've been finding lately?
I think the short answer is not enough. The guests that have been on your program today, I think, are much more forthcoming and much more inclined to deliver services than I've been able to find from appointed and elected public officials in Indiana County. I have to acknowledge that this is pretty much an unprecedented period in our history, and at least in the lives of most of us. So I'm sure that there's a lot of struggle to tend to regular business, not to mention the special demands that are imposed on officials of Indiana County in this period. But the, I would say, disorder and mismanagement that I read about every day in my mainstream news sources makes me wonder whether we're doing any better at the local level. And the Hawkeye is primarily devoted to the citizens of Indiana County. And the citizens of Indiana County, the Hawkeye assumes, might also have questions about whether their taxpayer dollars are being spent in the best way possible, especially in times of crisis and emergency. And so I've been reading about a lot of headaches, to put it mildly, that the federal government has got in just trying to deliver the kinds of equipment that Judy Holliday is trying to deliver here locally, namely face masks. And of course, there's a lot of confusion about whether face masks should even be used, which I think has finally been resolved. And the answer is yes, they should. It can't hurt, and it's probably going to help. But unfortunately, the federal government's supply of face masks, not just, is problematic. So when we hear that Judy Holliday is providing face masks to the Indiana Regional Medical Center and to the public employees at the public university here in town, that's interesting to me because I'm hearing that from Judy Holliday, not from the local officials here in Indiana County. So a lot of the questions that I'm trying to get answers to on behalf of what I hope are the readers of the Hawkeye in Indiana County stem from those kinds of national federal problems. And I'm hoping that we can find that there's some better outcomes here in Indiana County. I would say that I can't be sure of that because the response that I've been getting are pretty sketchy.
Can I just mention something about that, Dave?
Sure thing.
Okay, so the requests that have come in from not necessarily the management people. They've come in from the people that are working, that are on the front lines. They're the ones that are asking me to do what I'm doing. And so whether or not the top management wants to jump on board yet, I'm not concerned about that. I'm concerned about the people that are having to deal with it face to face. And so with that, I'm trying to fill that need. And whether it is a matter of, overriding or not, or even asking at this point, I don't think it should matter if they're not getting the equipment that they need to stay safe. So from that perspective, I totally get why you're not seeming to get the answers that you're looking for from the powers that be. I get it, but I'm literally just doing this because people on hand are asking me to do what I can do to save their lives, or at least help. So even if their officials are like, I know at the very first week, IRMC was, you're not allowed to use them. Well, they've changed their minds since then. So for those who already had them, they were glad to already have them because they're being limited on the number of, or the usages of the, what they have in stock.
Yeah,
So,
I commend you, Judy, for doing that and responding to the obvious need of real people who are on the front lines. My interest extends beyond that to our government, and I think our government has a responsibility to respond first and foremost, since that's what we pay them to do.
I totally agree. Yeah, right. I totally agree with you. And sometimes, and that's a great job that you're providing, is reaching out and, I don't know what, if you want to say forcing the hand, or at least getting an answer. Our answers have been coming very, very slowly in the States. And the questions that have come to me, not only just in could I get these things made for people, but it has also been, well, how come they're not available? It's an answer I wish I could or a question I wish I could answer. But in the meantime, it's the frustration. My point to someone the other day was, I don't know why we should be reinventing a wheel that's already been figured out as far as distribution, when we have people that do know how to do large distribution and we're not utilizing. And that, I'm afraid, is a more of a political issue than a healthcare issue. That's my stick. So.
Good. Yeah, I see. I don't argue with that, Judy. I just think that the officials whose responsibility is the public health of Indiana County should be a little bit more forthcoming, not only with doing their jobs, but also as the Indiana County's pandemic emergency response plan that was adopted about 3.5 weeks ago by the Indiana County Commissioners says that the Indiana County authorities should designate a spokesperson to deliver regular briefings to the citizens of Indiana County. And I haven't heard anything of the sort. And I'm a little bit curious about why that is. So what I'm trying to find out from Indiana County officials is, why are we not hearing more information about why Judy Holliday has to make masks? And by the way, if we're getting requests from the custodians and the nurses.
Yes, and from the police department, and from the electric company, and from, I'll just keep going on and on and on. That's who I'm getting my requests from.
Right, so I think it's wonderful that you're able to respond. I think that raises some questions, and that's why I'm trying to get some answers out of the public officials. And as I said, Brandon, I'm not getting a lot of answers, even though there is some talk, some communication going on, but I would not characterize it as particularly forthcoming.
Yeah, I think that's right. And it's so looking at what maybe can push the envelope a little bit. People such as Judy stepping up to the plate and doing some of the work that we would expect wider coordination from. That should be putting pressure on, pushing for a spokesperson. David, are there other areas that you're identifying, perhaps other specific ways that we can start getting more information out? We've had a number of elected officials on this program. They've all said they'd be willing to come back for updates, and hopefully as they get more information, we can push them as well. But what are some of your other thoughts that we might be for a concerned citizen that wants information on their own? What could they be doing?
I think if I were a citizen of Indiana County, I would ask them why there isn't a easily accessible source of briefings about the situation in Indiana County. And like the coronavirus, an absence of information is also a pathogen. And it will make a community pretty sick if they don't have information that they need to know in an emergency. Lots of rumors get started, and a lot of people start acting on rumors, and that's not particularly helpful in cases like this, in my experience. And so I would hope that Indiana County makes provisions for the provisions of the emergency pandemic plan that they adopted just a few weeks ago, and that is regular briefings by someone in the know. Now, I will acknowledge that in the past week, and this is kind of what I've been doing for most of the week that I have time, is listening for public pronouncements from public officials. And there have been some of those. I'd say that most of them fall into the general category of generalizing and trying to buck people's spirits up a little bit, and a little attaboy and pats on the back. And that's wonderful. I think making sure that there's a measure of hope at a time like this, I think that's an important role for elected officials to have. But I also think that it'd be useful to have some numbers. So Judy, for example, has given, I think, the most numbers of anybody in Indiana County that I've seen. I would like to know how many ventilators we've got, because I'm reading a lot about how the sickest cases who are suffering from COVID-19 absolutely have to have a ventilator. And if they don't have a ventilator, they're pretty much toast if they are susceptible to the virus in the worst possible way. So I'd be curious to know, before I have to go into the local hospital, how many they got. I'd also like to know some numbers about staffing. A lot of what I've been reading is that staffing levels, in fact, the Associated Press had a story that was published I think yesterday, Dateline Harrisburg, about the staffing problems that healthcare facilities are suffering all around the state, and not just in Pennsylvania. And a lot of it has to do with burnout. A lot of it has to do with people who have been infected by the pathogen. And it goes beyond that. There's a lot more detail that I would like to hear. And I think one of the things my ear perks up for are numbers. And if I hear generalities, that's not an unimportant thing to do, but I would like to know more about numbers. The other thing I've been interested in, Brandon, just for your readers' information, is that history suggests two things. One is that this will be bad, but it also says we will get out of this. And I think that is one of the positive messages that came out of some of the public officials speaking on local media this past week. So I think, for example, State Senator Joe Pittman articulated thoughts like that. This is going to be really bad, but we will get out of this. And I think that quotes Dr. Anthony Fauci, who was one of the leading truth tellers in Washington, D.C. over these past several months. And he also says, based on his vast knowledge of virology, that we can emerge from this. It's going to take a lot of effort to do so, but we can get better if we follow the expert advice that he and other scientists are providing.
Yes, I agree. And it seems like that information is getting out there to people, namely the two things that individuals can do is socially isolate to the extent they can, that's possible. And wearing masks, as we were talking with Judy about, interestingly enough, seeing people on the street outside around Indiana, you don't see a lot of people wearing them. But what we do know is if you're close to anyone, you should be wearing a mask or some kind of makeshift bandana, something like that. Not that it will protect yourself from getting it, but if you are passing people, say on a sidewalk or in the grocery store, it may keep, if you have been exposed to it, it may keep they're saying droplets, droplets from passing to them, because you would have a barrier for your droplets getting out. And I am starting to see a few more. So as of yesterday, I saw a couple of families that had either cloth masks, handkerchiefs, things like that. But then again, today, walking along the Hoodlebug, my sons and I were the only ones wearing such. So there is a role for local leadership to be getting that message out there more and more.
I have a hypothesis about why there are so few people wearing masks, or there appear to be few people wearing masks, aside from the supply issue. And that is that Indiana County's number of infections and, thank goodness, deaths are very low as compared with, say, Pittsburgh or Philadelphia, where they're very high. And that is, if we only have 9, that's up from 7 on Thursday, and by Saturday it was up to 9. It certainly sounds like, wow, we don't have it as bad. And it may be because social distancing is a part of living in a rural county like Indiana County. But history, and that's the other part of my reading of the past week, history says it is going to get bad. It will reach every corner of every niche and cranny of this country, according to the histories of the 1918 pandemic. And if anything, it's only going to get worse, and partly because the connections between rural and urban areas are much closer now than they were 102 years ago. So I would say that it's good to know that people like Judy are cranking out those masks. We're going to be needing a lot more of them in a hurry.
It's frustrating, I'll be honest with you, because even so much as, so you're driving in your car and you're going to go make a deposit at the bank. When you open your window, put your mask on before you do it. When you go to touch the keys to punch in, to put your card in, wear a glove. You don't know how many people have already touched that area, or have wipes that you can clean before you touch them yourselves. So, and to this morning, I've only been out twice since March 15th, to the bank, and then one day a week and a half ago to Martin's. When I came through, I was the only one wearing a mask, and the only one, as I was handing my things off to the cashier, in gloves. And unfortunately, the cashiers and our food service people that are having to work aren't wearing gloves, aren't wearing masks. They're in front of people doing drive-through all the time. And yet the only thing I was told from the cashier at Martin's was she was not allowed to touch like my bag, but she's touching the food I've picked up, and nobody else in the entire store had anything on. It's if you take some simple steps to protect yourself and protect others, then the numbers in Indiana County, one, do we have enough of the testing anyway? And are those who are sick having to hit certain guidelines before they're even allowed to be tested? So we don't know how skewed those numbers are anyway. That's something that is a little on the frustrating side. Those are numbers that I do think that, having spoken to two sisters who are nurses, one in Philadelphia, one in Florida. Numbers are only as good as what you're being told and being put out there. So I hope we can dive into it enough to be able to find out. But I think numbers are low right now, and numbers are low not because the chance of the pandemic in the area is low. I think numbers are low because that's the information we're being given. That's my take.
So we'll continue here at the center to push local leadership for some more information and to share those numbers. And last thoughts based on what Judy and Dr. Loomis were saying. Once we go outside, probably it's a safe bet to assume that every surface could be contaminated or is contaminated, and every person that we walk by may be infected. So that's the washing your hands and wearing your mask. We're going to wrap up here in the next few minutes, but I'll give it back to you, Dr. Loomis. Any closing thoughts that you think we should have on our minds going into what's potentially, if Indiana County is like other places, the numbers will continue to go up and things will continue to get scarier?
Well, I look forward to hearing from Tom Stutzman, who is the Director of Emergency Management in Indiana County. He has been on a radio program on Renda Broadcasting's airwaves. I think it was Thursday or Friday. Friday it was. And I found his remarks pretty helpful, not particularly quantitative, but I thought a little bit more direct than some of the other officials of Indiana County. And if I'm not mistaken, he's appearing on your program this coming week. So
that's correct.
I will be looking forward to hearing what he has to say. One of the interesting things that he did say is that there is a daily briefing at the hospital, Indiana Regional Medical Center, at which he and other stakeholding agencies attend every day, or remotely, I assume, or I hope. And I would like to know more about what information is coming out of that. Because when Indiana County is concerned about drunken college students having parties on March 17th, it's amazing how they mobilize multiple agencies and organizations to try and squelch students from having parties. This is a little bit more serious. I think there are at least as many stakeholders engaged, and I think that the emergency management people are well positioned in this time to be a pivot point for information that would be useful to the citizens of Indiana County. So I'll be looking forward to hearing from Tom Stutzman later this week on your program.
Thank you very much. Dr. David Loomis joining us once again with information he's bringing from his investigation. We thank you, Dr. Loomis.
Thank you.
Dr. Moore, this is wrapping up another episode. Do you have any closing thoughts and want to open it up to our guests for any other thoughts or ideas they may have?
No, not really. Just letting everyone know that we will be back on Tuesday. Our time might be moving a little bit later in the evening, so please watch out for announcements on that. We are going to talk with some local business owners, some yoga and fitness people around here as well. What rules are for shopping in Indiana. I was actually just told by a friend they went to go to Walmart. Now, this was in Westmoreland County, and Walmart is only allowing 100 people in their store at a time. So, and it wasn't like that when they went there the week prior to. So we're going to be talking a little bit about what shopping is like here in Indiana. If some of the retailers are going to pick up on some of those recommendations as far as social gathering, how many people are allowed in, what are some of the rules. We know times have changed. Some of the retailers have decided they're going to have elderly hours, where just people that might be more at risk of a fatality due to COVID are able to shop and then have other shoppers in after them. So we're going to look at that as well. And we're going to look at some ways that you can help support your local businesses. And it's really important right now that we're looking at 3 different types of businesses. We're looking at people that are full blown. They're open. They can, the COVID-19 virus hasn't really affected them fully because they're considered essential business. So we want to look at that. We also want to look at businesses who have been partially closed. So this would be like restaurants that still have pickup or to go. Then we have some businesses, unfortunately, who have totally closed down their doors because they're not considered essential. And we just want to see how they're doing, check in on them, and then see how our local community can help.
All right. Thank you, Sybil. So that wraps it up. Thank you to all of our guests for joining us today. And we will be back again on Tuesday. Stay safe and well.